Welcome to the Medical Sales Accelerator Podcast. I'm Zed Williamson.
And I'm Clark Wiederhold.
This podcast exists to put scale to the value you get from those great one-to-one conversations at conferences and sales meetings.
From selling and leading medical device to a life on the dark side.
That's why we're speaking with our guest today, Matt Ganem, co-founder and CEO of National Breathe Free Sinus and Allergy Centers. Matt, thank you so much for joining us today.
Zed, Clark, thank you guys so much for having me. I'm excited. It's going to be good.
You used to be selling and leading teams in med device. You had a long, distinguished career there, but now you're building a platform of practices around the country. And I'm curious, what do you wish you knew when you were still selling devices that you have learned from running and growing practices?
That's a great question. I thought about this a lot. There's been so many times over the last, call it 4.5 years, where I'm like, man, if I could go back to 2012 or 13 with what I know now, some of these, most specifically started around insurance. So when we would come in and say, hey, guess what? Anthem started to cover this. Like, what does that mean? That doesn't mean you can just bill Anthem for whatever the procedure is and expect a payment within 30 days, right? What does that mean? So knowing more specifically what the guidelines are for each insurance and sort of understanding from a fundamental standpoint, why did Anthem or Aetna or whoever put these guidelines into place? Because as a rep, that helps you have conversations around who is getting treated, who we're offering treatment to, and when and why. So, more granularly, I wish that I would have sat with, a comfortable, went to an office where I felt comfortable and gotten with the surgery scheduler and spent 2, 3, 4, maybe even a whole week with them, understanding what they go through. How hard is it to get it authorized? Because for example, if we go back 5 years for sinus surgery in the operating room, nobody had an off, which just meant you could do whatever you wanted. It was the doctor's decision. It was up to their medical judgment, right? But now you're in the office and these procedures are taking place and they're putting more guidelines in. So what does that look like? How hard is that for the office? How hard is that for the physician? How do they even know what treatment the patients are supposed to be under? Because if you know all of that, then you can help have really particular directed conversations, which actually add value to the practices, and you could really get them up and running in a comfortable way. And you could actually be the expert you need to be versus just coming in and saying United Healthcare covers. So it's like, I didn't realize what all went into that process. I would just say, look, 80% of their lives are covered. And so, there's people doing procedures that don't have the appropriate authorizations, and now they're getting burned. And then, that's the last thing you want. So, that's really the biggest thing is I wish I knew what I didn't know. I wish I even knew that I didn't know enough about insurance and how to run that from a authorization standpoint. It's paramount for whether it's ENT or anything else, because a lot of the things in the operating room do require auth that aren't in ENT. And, how do we manage that to make sure that we're not getting burned? And the worst thing that happens that nobody knows about from the medical device side, like there are plenty of offices that will bill the patient what they thought they should have got from the insurance and send them to collections. And that's one thing we never do, no matter what. I won't send anyone to collections if it's $5,000 or $5, because we know what that does to people's lives and credit and things like that. But in a hospital, if there's something that's not covered, the patient's going to have to pay for it. And that's something that people don't really think about.
Yeah, you mentioned a word. You said value. That's a word that gets thrown around a lot in the sales world in general. Most of the time, I'm not sure they even know what they mean. I'm curious on your perspective after now having a lot of reps coming and calling on you guys, what your perception is when that word's thrown around.
Yeah, it's a word that obviously, you and I and our counterparts way back when would say, like, hey, I brought so much value to you, you can't change. Or I brought so much value to you, you can't ask for a discount, right? Yeah. And so there's a fine line with that too, because let's say, Clark, you helped me start my practice, you got us up and running. Now we're doing these procedures. I've been buying product from you for 2 years. At what point does that value that you brought then expire, right? Because you can't, lean into something that happened a long time ago, right? There is loyalty, but what I will say from the flip side that is an interesting thing that I actually learned from Dr. Khanna. He said, hey, if we use everyone, our price is going to be lower. And it's kind of interesting. If you walk into an Acura dealer and you say, hey, I love Acura, I'm going to buy an Acura. Let's talk about the price. They're not going to discount it. But if you say, hey, you know, I'm not really sure, I might go buy this Toyota, then we're having a pricing conversation. So that's one thing. As an aside, is that if you only use, if the customer that only uses one vendor pays the most, because you know they're not going to leave, right? But back to the value, I mean, there's a lot of things that bring value. A lower price brings value. Patients bring value. If you think about it from a business standpoint, you need to have a lower cost, or you need to have more revenue to create more profit. In a medical setting, in a hospital specifically, for every one, if you to make $1 extra of profit from where you're at, you need to bring in $8 of revenue. It's not like one-to-one, like, oh, I'm going to bring in more revenue, I'm going to get the appropriate amount of profit. And that's just in a hospital. I mean, in an ENT practice, it's a little bit of a higher margin. So there's, how do you could bring that value? Or, I mean, think about what you got to figure out, what makes the people tick. So for example, there's two different modalities to treat polyposis post-surgery that exist. One of them is a biologic injection that has a lot of hoops to get an authorization, and it requires diagnosis that kind of make it a little bit difficult for us to do office procedures. And then there's another one that's a nasal spray. It's just a delivery device for mometasone called Xantz. The value of Xantz for us is that it's way easier on the staff and way easier on the mid-levels and the doctors to get this thing approved and to get it to the patient, which helps them. They both help. So, you know, Xantz figured out a way easier way for this to take place for us. So now we can just go in that direction. So that's actual value. You're saving time in the clinic. That's adding to the bottom line. It's allowing us to do more productive patient-facing things with our time, right? So that's value. But just saying like, hey, I took you, you know, I brought your staff lunch and I taught them how to, you know, set the device up. I mean, that's 101. That's not value. So I think it's something that needs to be considered when you're going to use that word, to make sure that it's actually something that's happening. And then two, figure out whether it's, you know, what the office manager needs or the authorization person to make their life easier. That's value. It's not just, hey, you need to use me because you, you know, we helped you 3 years ago. Or I've even heard, you know, you used to work here. Like, you know, doesn't that mean something? And it's just like, that was 5 years ago. You know what I mean? So that's just something that doesn't resonate. So I would caution folks to be careful about using value unless there really is true value. I mean, we can all think of, you know, 3 or 4 or 5 practices or doctors that we actually added value to, and we could quantify that and discuss it. But there's plenty of places that we just, you know, yeah, maybe our product was a little better and we were available, so they used it, but that's not value.
What it sounds like is there is, now I feel like I shouldn't use this word, but there's value in zooming out a little bit and understanding that you're not selling in a vacuum. You're not selling for a device to be used in a 15 or 20-minute section, and that's the only thing. Is that you impact other people in the practice. You impact everybody that touches that device. You impact the people who touch the insurance, who touch the scheduling. And if you only zoom in to the aspect of the device only, you're limiting yourself. If you can zoom back and think of throughput of the practice, how are you actually helping this practice be a better place for patients to be treated? Am I off base with kind of positioning it that way?
No, I mean, you know, there's, you know, I want to say the customer service aspect of it, right? Because most practices, the traditional medical model is, I'm the doctor, you wait for me, I can be as late as I want, and you have to be super happy when I walk in the room an hour late because you're seeing me. And so that's a philosophy that we have, where it's like, we're going to actually be humans. And if we're running behind, we're going to let you know. And if something happens, we're going to try to give you as much notice as possible. And so to your point, like, how do you learn from an office that does it well and sort of kind of, you know, help them figure that piece out, because that's going to help their business so much and their practice so much. And it won't necessarily benefit you. It may lead to more procedures if you get better word of mouth and better reviews and things like that. So that's super important to be cognizant of. How can you actually add value? I mean, you're there. One other piece that I just thought of when you asked that question too, back to what I wish I knew. Salespeople tend to be pretty selfish, right? And I'm just going to walk into your office. Doesn't matter what's going on. Doesn't matter what time of the day it is. Maybe you're in the middle of procedures, or you got 50 patients and you're an hour behind. And I'm just going to walk in and I'm going to get what I want from you. I'm going to ask you the questions I want. You're going to go through and give me your schedule. We're going to talk about that patient in the post-op in the middle of your clinic. And Like, I would challenge people to be more cognizant of the fact that, there's a whole bunch of stuff going on. You can't just walk in whenever you want. So in our offices, we generally don't, for the most part, we don't allow reps in, because if we have something that we need, we'll contact them. But, you can't just walk in when a doctor has 10 procedures or a PA has 15 patients, an hour each, and they're running behind, and just start asking questions and then leave at your leisure. You know what I mean? It's just like, it's actually kind of, I don't know what adjective to use to describe it, but it's kind of just completely opposite of what anything else would ever happen in any business, that you would just allow someone who doesn't work there, who is a vendor, that just shows up whenever they want. You know what I mean? Obviously you get good relationships and the doctors don't really mind, but maybe the doctor doesn't mind, but what about the office manager and all these other people
scattering the rest of the day? Yep.
Yeah, it does bother them. And if you think that's not going to have an impact, if a competitive rep comes in, like, they're going to have a reason to try to get them in front of the doctor or get them a meeting with them, just because maybe you interrupt their day once a week for 30 minutes and it's in chaos afterwards. So something to think about.
That makes me think of, EQ, like emotional understanding of what's going on around you, and how do you fit in so that you're an additive piece as opposed to dragging the system down.
Yeah. I mean, you need to figure out, like, if you go in and it's like that, maybe you drop something off and you set up a time to chat later and things like that. Like, you just really do need to use, like you said, your emotional intelligence or awareness, and start to understand when it makes sense and when it doesn't. Because if the office manager is the key, because she's been with the doctor for 20 years, and every time you come in, you're disrupting her day, that's like his inner circle or her inner circle. And they're going to affect, your potential relationship, your sales relationship with that practice. So, I mean, you have to be super cognizant of that. And that's something that, candidly, maybe I was selfish. I don't know. I never really did that. I was like, oh, they don't really mind when I come, so I'm going to stop by in between this meeting and this meeting. But you don't realize that they're an hour behind that day, So definitely something that you could be aware of, and maybe even just overtly ask, like, hey, when's a good time to come by? And they might say, hey, Tuesdays and Thursdays, procedure days, like just never those days unless we need you. And then you could position yourself well there.
Another potential little hack, and this is just totally tactical, but it's just hitting me while we're talking about this. If you don't know, you can also just acknowledge the resistance, and that at least shows the person that you're paying attention. So that doesn't mean you have to avoid trying to go talk to them, but if you at least say, hey, I'm concerned that this may not be a great time to talk with you because of how busy you are. Am I wrong? And now they'll go like, he cares. And they'll either go like, no, it's cool, or you'll get the real feedback.
Yeah, no, you're spot on. I mean, even just that, like, showing that level of awareness, or maybe even care, probably will go a long way.
Yeah. I mean, situational awareness and understanding is always going to play well, to your point. Nobody expects you to know what's happening that's not in your world all the time. Like you talked about, Matt, I might not understand that they're an hour and a half behind, and maybe the doctor's okay with it, but the staff isn't, because that might mean they missed their kid's baseball game that evening or something, because they're having to do all the things. It has real impact. But just acknowledging that I stopped by, I'm in town for 15 minutes or whatever it might be. It looks like you guys are crazy. Do I need to come back? Gives them the opportunity to say yes or no, and an understanding, and you still made the stop by. It all. And
then they don't talk about you after.
Correct.
I was going to say, so if you flip it, and let's say you're a rep and you have like 20 cases that day, and you're zooming around from surgery center to surgery center, office to office, and some doctor is like, hey, I'm gonna stop by and meet you in the middle, and we're gonna talk for 30 minutes because I have some questions. It's like kind of the same thing, right? Like, that would never happen, but I mean, imagine how much that would interrupt your busiest day. So
yes, that's a great point.
A great analogy. There's a dichotomy to everything, and you do need to respect your own time and not be dragged all over the place by your territory, your region, whatever it may be. But take it too far, and that's having no understanding or situational awareness, emotional intelligence about what's happening with your customers' lives and then the entire ecosystem around them. I think that's what you're describing, Matt.
Yeah, so absolutely.
I'm super interested in learning. I'd love, you have such a unique position, and what you're building is amazing. I'd love for you to talk about, you were in the device world. You were from the ground up. Matt, we started as sales associates together, right? Moved into driving, being top reps, and moved into manager roles and whatnot. And then you've gone on from leading national teams with capital cells to like now building a tremendous platform of ENT practices. Walk us through what that's looked like with Breathe 3.
Yeah. So, I mean, if we take a 50,000-foot view of sort of how the idea came up, and you probably remember this. I mean, we'd go around and we'd go to these, center of excellence visits where it's, how is this doctor doing 8 of these things on a Friday, right? How is that happening? What goes into that? Why is that working?
Yep.
How is this doctor doing 40 in a month? Like, how does that happen? So kind of the idea was like, what can we do on the front end? I use the restaurant analogy. So if you're a top, Michelin star chef, you're in the back, you're making sure the food's perfect, everything's great. Who's watching the front? Who's making sure that the bar's clean? Who's making sure that, the hostess is being nice to the people that are waiting, right? So that's what happens in a doctor's office. The doctor's zooming around, seeing patients, doing procedures. And in most offices, there's nobody that has an eye on what's going on in the front of the house, right? And that's what they call it in a restaurant, or I would say the clinic, in the front desk for a medical office. So the idea was, how can we be as good at everything that's not medical as we are as everything that is medical? And what is that output going to look like, right? So that's sort of where it came from. And so I started towards the end of my time there, going to as many of these events and just asking the doctors, why is your volume like this? How is this working? What challenges do you have? What solutions do you wish you had for some of your problems? What keeps you up at night? And there was a doctor that said, hey, you know what, to be honest, I wouldn't be as successful without this person here. And I'm not going to use specifics, but I thought, okay, well, I got to be that person. And how can I be the best version of that person? And so that's sort of where the idea came from. And what's interesting is it evolved from like, hey, let's, have the best in-office rhinology practice that we can, to, we can help make surgeons' lives way better, take all the headaches out of off their plate. So essentially the message is, if there's another human being on the planet that can do it besides you, they should do it. So no taking call, right? There's someone that takes the phone calls intermittently. And then if there's something that's more emergent, then it gets to you, but you could do procedures all week and not take a phone call because there's somebody that we're paying to do that for you, right? Like, why are you doing peer-to-peers when the PAs can do the peer-to-peers, things like that. So it just makes your quality of life higher. And obviously we're the most valuable time in any practice is the surgeon's time, because that's the thing that can generate the most revenue and help the most people. And so why don't we just maximize that? So instead of a day and a half in the operating room, a half day on the golf course, and 3 days in the clinic, why don't you just give me those 4.5 days to do the most valuable things you can for your patients and for your practice? So that's sort of kind of the philosophy and where it evolved. But it was more about just optimizing the physician's time. I mean, it's completely logical in my mind. If we have people that are trained to see and diagnose patients just as well as a doctor is, I mean, it's pretty straightforward with sinusitis, right? I mean, it's not something where we're not dealing with things that are super emergent. Obviously, there's head and neck cancer and things like that in ENT that we send out to the experts for that, So if these folks are experts in what the little corner of what they're doing, then it allows the doctor to be super impactful on patients' lives and just spend their time helping those specific types of patients. So I don't know if I answered that question correctly or not, but I mean, that's sort of how the idea evolved. And just being essentially the doctor of the front of the house and being great at, insurance authorizations and things like that. I remember going to a doctor's office and he would say like, oh, well, I know, what the deductible and the coinsurance is of the patient before they come in. And the other doctor would be like, well, how do you do that? And so now we have over 45 remote employees that just go into the EMR, check the benefits, put the information there so the front desk has it so they can deliver it to the PA so the PA knows, or the doctor knows, it's this insurance. Here's what the requirements are. Here's what it would cost for the patient. And we can have all of those conversations on the first day versus, hey, we'll call you when we have the authorization and we'll try to schedule you. And then you call them 3 weeks later and they're like, what are you talking about? Yeah. I don't remember that. So
what's interesting about what you're describing is it's not only better for the clinic, it's not only better for that surgeon, it's also better for the patient experience. And so let's go back to earlier, take device and everything off the table for a second. The value is touching all of the stakeholders there in a very meaningful way. And that feels like it's by design.
Yeah. It's interesting. If you remember, Jim Surik would always say lightning in a bottle, right? Yeah. It's kind of what it is. Like, what is best for the patient is a a very minimally invasive procedure with minimal downtime and little to no risk, right? Done awake, you're back to work within a day or two. And obviously this isn't for everyone. There's other patients that need more, more surgical intervention, which we'll also do. And that's a different conversation, whether it's a septoplasty or an ethmoidectomy or, traditional FES techniques we can do, but a lot of the patients don't need that. So we have the best value for the patient. Then from a cost standpoint for the patient, if they have a coinsurance, it's going to be way less in an office site of service than a facility or a hospital. We can be flexible, payment plans, things like that the facilities will never do. It's, hey, Clark, you're having this procedure, you have a deductible and a coinsurance, bring $2,500, please, the day of. We're never going to do that, or most not always going to do that. We can be flexible. So what's best for the patient from a clinical standpoint and a financial standpoint, what's best for the doctor, I mean, they can be way more efficient when they're not waiting for room turnover. What's best for the practice, right? And then it allows us to spend 45 minutes to an hour with each new patient. And that's how much time we spend. And we can also, in nearly every practice, we have immediate availability. There's not a 3, 6, 9 month or 9 week wait. We just bring more folks in so that we can get people in a timely manner. So it creates a better patient experience. So what's best for the patient is what's best for the practice. And it's covered by nearly every insurance, right? And that's because there's a value for them there as well. So there's not that many times in business or specifically medicine where there's that much alignment. So
what were things like in say 2020 when the world got turned upside down versus today?
Yeah, so it's kind of interesting because going into 2020, we had just our main flagship Capital Breathe Free practice. We started with Monty Trimble and Dallas Breathe Free at the beginning of February of 2020. And we started to hit a stride, and then, COVID hit, and actually in Texas, the governor mandated that all medical practices close and that you couldn't even do elective procedures in your office. Whereas in like the state of Virginia, you couldn't do elective procedures in a hospital or a surgery center. And for example, in Virginia, they have certificate of need laws, so there's almost no surgery centers that are physician owned. So there was no procedures taking place unless it was done in an office. But so we had one, I guess, 2 clinics going into that, and COVID actually, it was scary in the beginning. We were super cautious. We didn't close, but we had, huge gaps in between our patients, and we were doing all of these things with air purifiers and sanitation and stuff like that, trying to make sure that we were safe. But once we sort of kind of got through the summer and we were like, all right, like, this thing's starting to kind of not go away, but we're starting to understand it a little more. We can kind of work within the system the framework that we were given. It started to promote folks wanting to leave the hospital because they couldn't operate anymore, and they weren't even making their salary because they're RVU based and they can't operate. So there's no RVUs. And so it actually helped us grow because there were folks that were unhappy and employed, whether it be in a private practice or in a hospital or something like that. They wanted to get to where they had more control of their time. And so that actually helped us grow. I mean, we're in a great spot now where we have 20 operating clinics, which obviously, again, going back to 2020, we just had 1. At this time in 2020, we had 2. So we would be in a good spot, but I don't know that we'd be where we are if it wasn't for the challenges that COVID provided a lot of ENT practices.
So first of all, congratulations on that growth. It's awesome. When you go from 1 practice to 2, there's significant increase in complexity. When you go from 2 to 20, the exponential increase in complexity is it's enormous. From your perspective, what are some of the grounding principles that have helped you drive a successful organization? What's really keeping you moving towards that success?
I mean, I think in almost every business, it's probably the same. It's finding great people. I mean, you got to know your blind spots. You got to know what you don't know. Surround yourself with people that know the things you don't know. And once you find these great people, you need to put guardrails or procedures in place to keep them. That's the second hardest thing to do is keep great people. So, I mean, you have to have a people first culture. For example, our core values walk through sort of what we're looking for: integrity, compassion, gratitude, extreme ownership, which is super important to us. If you guys haven't read, I'm sure Clark's read Jocko's book, maybe you have. That's one of our core values. We give out an extreme ownership award at all the values awards, but an extreme ownership award at our meeting. But our purpose is to change people's lives, and that I don't take that lightly, and it's very purposefully not patients' lives. The assumption is that with great clinicians and innovative procedures and techniques, you're going to change patients' lives. You're going to help them sleep better, help them breathe better, help them be able to get on a plane easier, all of these things. But the reason that it's here, the reason that it's people's lives is because it's not only the patients, which we know we're going to impact and we have impacted, it's the people that come on board and take a leap of faith with us, whether it's like Monty Trimble, the second doctor we signed, like that was a pretty big leap of faith. How do we make sure that he's happy? I told him in the beginning, 6 months in, I want you to say this is the best business decision you've ever made. And I say that to everyone. I want everyone to feel that way. But it's not only the doctors, and it could be the front desk person that you hire, and you're like, oh, well, I hope this person works out. And the next thing you know, a year and a half later, they're running a clinic. We have someone like that. We have someone that travels around and opens new clinics or goes to clinics that need help that used to work the front desk. And we have plenty of examples of that. And so it's changing people's lives. It's our own lives. It's the physicians' lives. It's the PA's lives, the patients' lives. It's everyone. So if we keep that lens all the time when we're making decisions, then we have a really good opportunity to be successful, because this is a place that people don't want to leave. We have very low turnover in all of our positions. But the most important one to us is our mid-level providers, because they're the ones that see all the patients. Obviously the doctors see some patients, but they see most of the new patients. They see most of the post-ops. They see most of the continuum of care patients. They're also looking through scans to identify that there's nothing goofy going on and that there's not anything of concern that we need to send someone out for. So they're doing all of these things, and so having a low turnover rate there means that we're doing something really well. And as you grow, like, as you know, as you grow, it's harder to keep that same feel that you would have had when you just started and there was only a few people. So as we continue to add people in clinics, how do we make sure that we're making people first decisions consistently? So, I think that's the best way to do it, is find great people, hire slow, fire fast is what, some say, something like that. But make sure you find great people, and then you got to keep them. You have to do whatever you can to keep them.
I'm smiling hard inside when I listen to that core value of breathe freeze, because it's very similar to one of our core values, or we're really one of our beliefs internally is, and that description, that language that we use inside the building is to help people realize they don't have to live that way. And that reigns true. And it starts with our own internal team. And new customers that come on board with us are always a little shocked when we say that, because they automatically go to the patients that we connect with, our clients and things of that nature. But it really starts with our core team. And it sounds like that's what you're describing, is it's not the patient outcome. That is true, but it really starts with your own internal team and the core team, because that's going to deliver out to the patient outcome as well. Am I off base there?
No, I would say, it is like helping people realize they can't live that way, because I want to see, like, the number one thing that for me that resonates and makes me feel like we're doing great things is when I see someone achieve something, whether it's a skill or a position they never thought they could have, or maybe it's, I've never been able to buy my, we had a doctor that bought his family 6 Super Bowl tickets this year. And he was like, dude, if we didn't come to work with you, there's no way in the world I would have been able to do this. So thank you. And I'm like, you did all the work, not me. But of course, but that's the point. It's just letting people know that whether it's, a medical assistant that grows and can, now take their mom on a cruise or something like that. Like, I want to see all of those types of things, because obviously this wouldn't work if patients weren't getting better, but that's the second most important thing, is seeing that type of growth in people and having them achieve. I never thought I would ever have a job like this. That's those are the most satisfying things that we can see. That, at least from my lens or my view, that we could ever have is people that feel that way. They feel great about it,
Matt, I'm going to put you on the spot here. And so hopefully you're cool with this, but I know a story of a young man that came to work for you guys in a very unusual circumstance, and it's the impact that it's made on his life. Would you mind sharing that with everybody?
Yeah. So we do a national meeting every year. It's coming up next month in Miami. Last year we did Scottsdale, Arizona. So this was in Scottsdale. We hired this gentleman in Connecticut in February of 2022. So he told this story in August of 2022. So we're talking 6 months in. We were back then. Now we have a team of people that do all these openings and are very comfortable and are a little more organized than we were. So we're, a couple days in, we're trying to install TVs on the walls. We need HDMI splitters. It's like 8 o'clock at night. It's snowing. It's like 10 degrees. And so Taylor and I go to Walmart, and we just need these splitters. And we go in, and it's madness in there. And there's a kid in there, and he's helping someone find something in the electronics area. And we're like the next person to be helped. And his boss comes up. It's like, Eric, did you take a break yet? And he goes, there's way too much going on here. Like, he's friendly about it, but there's way too much going on. I can't take a break. And you look over, and there's like 5 other employees doing nothing. And so he's just hustling. And so we were like, we should hire this kid. So we hand him a card, and we're like, hey, give us a call. Like, we have a job for you. We're an ear, nose, and throat office. So, we started working with him right across the street. And, I didn't hear from him actually for like a day or two, and went back in there to try to talk to him. He wasn't there, and he ended up calling me, and he was like, I sent you a text message like you asked, but I sent it to the wrong number. And I thought he didn't call us, and we need good people. I'm like, this kid's great. Like, you want someone that's great, that has a great attitude and a great work ethic. And so long story short, he comes in for an interview. His grandparents, who he lives with, he's 17 years old, just graduated high school, don't believe that a medical office would actually hire someone from Walmart with no experience, right? And we look for, just great people that can learn. You can teach people anything, unless there's a certification or a license you need to have, of course. But for a medical, for someone that rooms patients or answers the phones or helps out in procedures, we could teach anyone to do that. So comes in, his grandparents didn't know what we were up to, so they sat outside the building and put an air tag on him and watched him walk around the building, thinking like, there's no way, there's got to be something weird going on here. So then even like a week after he started, they still didn't believe him. So he's like taking pictures with us, taking pictures with the doctor, like selfies, like, look, I'm in scrubs, I'm actually working here. You know what I mean? So he tells that story. And as he's telling the story, he starts tearing up, and he says, I wanted more for myself than what I had. And I know I just graduated high school, but I didn't know how to get somewhere that I felt good about. And so you guys gave me the opportunity to do that. And I'm not even talking about the fact that I'm making more money. I'm not talking about the fact that I'm in a leadership role. I'm talking about the fact that I can feel great about myself, and my family can feel great about the fact that I'm making something of myself, at such a young age. And I'm giving you the abridged version, but I mean, there's 100 people in that room, 90 people were just peers, and he's such a great kid. And now his mom moved to Connecticut and works for us. And it's like, we've changed his life so and he's a sports fan, and now he'll like send me pictures. He's going to the Knicks game, or going down in the city and going to a baseball game. And he's like, I never would have been able to do that if you guys didn't walk in that day. And I'm like, we wouldn't be where we are if you didn't have the work ethic you had that day.
Right.
Because if you were not there, we wouldn't have you, and we wouldn't be where we are. So it goes both ways, but those types of things are what make me want to continue to get up every day. And the stories that I tell when the docs are like, well, what kind of people do you bring on board? What if I don't like the people you bring on? What if I don't like the culture and things like that? And it's just like, we're not going to be perfect, but we're going to hit on that one. I mean, that's big. And as you guys know, you can't run a successful organization of any kind without great people. But if you can have people, that are that impacted by the organization, that aren't patients, because the patients are impacted too. There's plenty of reviews that will prove that, but it's more about just changing people's lives. And that story will always resonate with me. And like, I know we'll probably have him tell some version of that again, because there's gonna be so many new people in the room, and then just water works for everyone. So he's a great kid.
It's incredible. I love it. It's a testament to what you've built and the continued success that you guys see. Love hearing stories like that. And I love your perspective of, it's not just great for him, it's great for you too. And that's what sometimes people lose sight of, that is that, he's helping you guys out, which is helping patients out, and that's helping you out. And that's how that inertia and that flywheel goes, and it gets to a point where the spinning can't stop. And that's what I think we're witnessing with your organization. Matt, I really appreciate you joining us today on the podcast. We will put links to National Breathe Free and Sinus and Allergy Center website in the show notes. Do you mind if we put your LinkedIn in there also, if people want to reach out to you directly?
Please, yeah. I mean, you could even put, I put my cell phone on there if you want. They can text me or call whenever they have any questions. If you go to our national website. You can click view affiliates so you can see each site. And then if you click request information, that'll just go to email to me. So however, if anyone has questions or comments, feel free to reach out whichever way you want.
Excellent. Appreciate that. Also, visit medicalsalesaccelerator.com. When you do so, download a resource to help you be a better communicator with your customers. Sign up for emails to find out about upcoming episodes. And also, you can click to suggest a guest or a topic.
If you found value in today's episode, do a few things for me. Subscribe to the podcast. We love those subscriptions. It helps other people find the content more easily, and it makes the show look really good. Leave a review. We want those 5 stars. We love those 5 stars as well. Suggest a guest from the website and go to the box with an arrow out of the top. Send it to your mama, your daddy, your friends, your family, your colleagues. We greatly appreciate it. Matt, thanks for joining us again. Make it a great week, everybody.